What if the drugs that changed your life could suddenly become affordable? Zepbound, Wegovy, Mounjaro, Ozempic. If you've had to pay out of pocket for one of these medications, you know the story: over $1,000 a month if your insurance doesn't cover it, and many don't. It can feel impossible to stay on treatment. But now there's a new twist in the fight for affordability. Yesterday, President Trump gave 17 of the world's largest drug makers an ultimatum. Cut your prices to match what other countries pay or face federal action. And they've got just 60 days to comply. Hello everyone, my name is Christopher Durham. My wife Laraine and I have lost over 150 pounds between the two of us using GLP-1 medications to treat the disease of obesity. And this is the Downsized, where we bring you the news that matters to patients, the stories, the insights, and occasional laughter. Before we get too deep, let me say this very clearly. This is not a political channel, but when government policy directly impacts access to life-changing GLP-1 medications, we're going to talk about it. You don't have to agree with everything we say or every politician, but you do have to be kind. This community fights obesity. It does not fight each other. So let's keep the comments respectful and focused on the real solutions and the conversation around fighting this disease, increasing accessibility and increasing affordability. So as I said yesterday, Thursday, July 31st, President Trump and his team released a series of letters addressed to top pharmaceutical companies, including Eli Lilly and Novo Nordisk, the makers of Zepbound, Mounjaro, Wegovy, and Ozempic. The letters demand that these companies cut U.S. prices to the most favored nation level. That means matching the lowest price they offer in any other developed country. Now, there's nothing to stop them from raising prices in other countries or from withdrawing from some of those countries. And if they refuse, the administration promises to deploy every tool in their arsenal to protect American families from continued abusive drug pricing practices. In the letter, the White House makes its position clear. You must lower your prices to most favored nation levels by September 29th, 2025. The time for negotiations is over. The companies were told that the American public is no longer willing to subsidize cheaper drug prices abroad while paying the highest prices at home. The letter says it is unjustifiable that American patients pay more than double and sometimes triple what patients in other developed nations pay for the exact same medications. Big Pharma is now scrambling to respond. The White House didn't just ask for a conversation, they demanded binding commitments. According to the statement, drug makers must commit in writing to cutting U.S. drug prices across multiple channels or risk serious consequences. And the warning isn't vague. The letter states, if you refuse to step up, the federal government will take appropriate action to ensure that the American people are no longer held hostage by your pricing practices. In total, President Trump's team sent letters to 17 of the biggest drug companies in the world. That includes Eli Lilly, Novo Nordisk, Pfizer, Johnson & Johnson, Merck, Sanofi, AbbVie, and GSK. Also on the list, AstraZeneca, Amgen, Regeneron, Gilead, Boehringer Ingelheim, and Genentech, which is part of Roche. And rounding it out, Bristol Myers Squibb, Novartis, and EMD Serono. Now, these companies weren't just asked to think about lowering their prices. They were given a list of demands. Here's what the letters told them to do. 1. Offer the same low prices to U.S. Medicaid patients that you offer in other countries. That's called most favored nation pricing. 2. Don't give any other developed country a better launch price than what you give in the U.S. 3. Let patients and employers buy directly at those lower prices, cutting out the middlemen like pharmacy benefit managers. And 4, if you're charging less overseas, raise those prices and use that extra revenue to lower prices here at home. It's a sweeping move, one that basically tells Big Pharma, stop treating American patients like second-class customers, or the government will step in. This all builds on action taken earlier this year. In May, the president signed an executive order titled Delivering Most Favored Nation Prescription Drug Pricing to American Patients. That order specifically aimed to tie the prices of U.S. drugs to the lowest prices charged in other wealthy nations. That framework set the stage for what happened this week. The White House says they've spent the last few months negotiating privately with pharmaceutical firms, but that those proposals have fallen short. Now they're done talking. So from the White House fact sheet that they published yesterday, from this point forward, President Trump will only accept a commitment that provides American families immediate relief from vastly inflated drug prices. Americans pay on average over 3 times what other developed nations pay for the same medications, even after rebates and coupons. We are less than 5% of the world's population, but account for 75% of all pharmaceutical industry profits. Why? Because of how the U.S. system is built. Unlike Europe, Canada, and much of Asia, the USA has no national pricing regulator. We do not negotiate drug prices at the federal level. Instead, insurers, pharmacy benefit managers, or PBMs, drug distributors, and retail pharmacies all take a cut, adding layers of cost before the medication ever reaches a patient. PBMs were originally created to help health plans manage drug costs and access, but today they operate as powerful middlemen, negotiating rebates from drug makers, determining which drugs are covered by insurance, and controlling what you pay at the pharmacy counter. They profit by keeping part of the rebates and fees they negotiate, which means the more expensive the drug, the more they make. In a congressional hearing last year, the outgoing CEO of Novo Nordisk testified that 74 cents of every dollar a patient pays for our medicines goes to pharmacy benefit managers. PBMs add complexity and cost without improving care, and their influence is one of the key reasons Americans pay so much more than the rest of the world for the same medication. And that cost isn't theoretical, it's real. It forces people off medication. It widens health disparities, and it keeps science-backed treatments out of reach for millions of Americans. At least a few pharmaceutical executives are acknowledging the reality. AstraZeneca CEO Pascal Soriot said this week there are issues around prices. I personally believe the president is right to say price equalization should happen. He confirmed that AstraZeneca has been in close talks with the U.S. government over both the MFN policy and investment in American manufacturing. Just last week, the company announced a $50 billion investment in the U.S., a move many see as both economic and political. Novartis CEO Vas Narasimhan echoed that support, saying last month that his company was already pursuing pricing policies aligned with the MFN strategy. Novo Nordisk, on the other hand, issued a statement saying, "We are focused on improving patient access and affordability and will continue to work to find solutions that help people access the medications they need." As of recording, Eli Lilly hasn't said anything. Still, none of the companies have committed publicly to the 60-day demand. Wall Street is watching closely, as you can imagine. JP Morgan analysts released a note to clients on Friday that suggested this may be more of a warning shot than a binding threat, at least for now. They said while the government's latest announcement may appear harsh, we believe no changes that would have a significant negative impact on pharmaceutical companies will occur in the short term. In other words, they do not expect major price cuts tomorrow, but do expect this issue to stay in the spotlight and the pressure to keep building. Meanwhile, the pharmaceutical industry is asking for clarity on another looming threat: international trade tariffs. President Trump has previously floated the idea of industry-wide tariffs as high as 200% on pharmaceutical imports. If that happens, it could shake up global supply chains and raise costs in ways that even big pharma cannot fully predict. So what does all this mean for us, for the GLP-1 users, for people trying to treat the disease of obesity? Well, right now, we all know there's only 4 GLP-1 medications available that are FDA approved and widely used for long-term care: Zepbound, Mounjaro, Wegovy, and Ozempic. And they all come from just 2 companies, Lilly and Novo Nordisk. They're the dominant players in the treatment of obesity and type 2 diabetes, and they've helped millions. But for patients paying cash, the cost is crushing. For Laraine and I, this isn't some abstract policy debate, it's personal. We're a small business. We buy our insurance from the marketplace in North Carolina, and not a single insurance plan available to us covers GLP-1s for obesity treatment. Not at any price, it's simply not available. We've paid out of pocket for every dose. And we've heard from hundreds of you in the same boat, spending $500 to $1,200 a month, getting denied by insurance, having to pause treatment that's actually working because the cost is too high. If this initiative works, even just a little, it could make a big difference. We're talking about better access, lower out-of-pocket costs, fewer insurance denials, and more people staying on the medications that are actually helping them heal. But let's be real, this is not going to be easy. In Trump's first term in 2020, a similar most favored nation rule was introduced and it never made it. It was blocked in court before it could take effect. Pharma companies sued, lobbyists pushed back hard. So expect a fight this time as well, maybe an even bigger one. The drug makers now have three choices. Number one, comply. Comply with the 60-day deadline and commit to the pricing change. Number two, negotiate with the administration to find a compromise. Or three, fight. In the media, in court, and behind the scenes in Congress. They'll have lobbyists out, you know it. And the White House has made it clear if these companies do not cooperate, there will be consequences. That might include trade penalties, new pricing rules, or even limits on how much the government buys from them through federal health care programs. If you care about this, and we definitely do, then now is the time to speak up. Call your lawmakers, email them, text them, Instagram, TikTok, it doesn't matter. Reach out. Talk to your HR department. Ask your insurer why these medications aren't covered. Share this video with someone who's struggling to afford this medication, because affordability is access, and access saves lives. We'll be watching this story closely. If Lilly, Novo, or any of the 17 companies respond, we'll break it down right here on the Downsized. And one last thing, let's keep the comments kind. We may not all vote the same way, but we are united in one belief. Obesity is a disease, and people deserve affordable treatment. If this video helped you, please give it a like, subscribe to The Downsized, and share it with someone who's been forced to stop treatment just because of the price tag. And here's one final thought. While these letters are an interesting step, real change will take more than executive action. If President Trump truly wants to lower drug prices for Americans, the next step is working with Congress to pass legislation. A bipartisan move. Build laws that prevent pharmaceutical companies from charging U.S. patients and taxpayers the highest prices in the world. Take a look at our system, at our pricing regulation. Streamline everything. Make it work better for Americans. Presidents cannot write laws, but they can lead the effort to get them passed. That means building coalitions, finding common ground, and turning headlines into lasting solutions. We don't need more pressure. We don't need more policy. We don't need more gestures. We need guarantees. We need better pricing. We need better accessibility. I will call to you, President Trump, and to every legislator in America. The same call I have called to Lilly and to Novo Nordisk. You can be the hero. You can help the 74% of Americans who have overweight or obesity with better pricing and better accessibility. Be the hero. Not just the voice calling for change, but the force that delivers it. Because bold letters might start the conversation, but binding laws are what truly move the needle. My name is Christopher Durham, and we are The Downsized.